So this is before it was coordinated too, so.
All right. Good afternoon. Thank you for being here. My name is Kathleen Beckman. I am the chair of the board of directors for the Pinellas County Continuum of Care. And I'm very happy that you all are here today. It's nice and cool inside and not raining right now. And we have about 17 or 18 people online. Yeah. So we have a good attendance, 20 today, for our general membership meeting. So thank you very much for being here. I want to take a minute to just state, for those of you that don't know, I state this at every meeting that I'm at, is that our CoC vision is to make homelessness rare, brief, and a one-time experience. And the vision and the CoC mission is to coordinate all community partners, systems, and resources with the goal of helping individuals and families to prevent, first, divert, and end homelessness in Pinellas County. And so the more people we can have at the table, faith-based leaders, business, people with lived experience, providers, funders, just anyone who lives in our community really and cares and notices needs to have a seat at the table. So that's the vision and mission of the CoC. I'll take a minute just to introduce members of my board that are here that I know. So Elise Minkoff is here and I've got your title, Elise. Chief Director of Operations at the Pinellas County Housing Authority. So thank you for attending. Is there anyone that you know from our CoC board?
Kevin Marone is.
Oh, Kevin, good. So Kevin Marone is online. He's the CEO of the Boley Center. He's also part of the executive board. So thank you for being here, Kevin, as well. Sherry, do you want to?
Yes.
Sherry.
I'm Sherry Boltzbacher. I'm the interim CEO for the Homeless Leadership Alliance. And I want to introduce, I know we have one board member as well here, Susan Meyer, who also was CEO of the HLA during the transition from the HLB to the HLA. Do we have anyone else online? Okay, and so thank you, very, very glad to see y'all. Thank you, and you online as well.
Okay, well, moving along, so we've got, we're going to have a presentation from the Pinellas County Housing Authority, from Elise, Chief Operations and Programs Officer, about what they do here and the importance of their organization to helping people secure housing. Elise, are you gonna come up? Is there a PowerPoint and all that?
No PowerPoint,
Okay.
none at all.
I like your
It's me. It's me. I don't know where to stand, but
Where's, do you know where we? Do we
Right by the
have
podium?
Camera? Or is it all just?
or is it all just PowerPoint?
Okay.
So the owl's right there, and
Okay.
wherever you're talking, it should find you.
Oh my.
At all angles.
Okay. All right, Elise Minkoff. I am now a 2-year veteran at the Pinellas County Housing Authority. Just a little bit of background, I hail from the state attorney's office and from the public defender's office. I have a law background, but I don't do law, ladies and gentlemen. I caught the cure. I leave that lawyering up to my husband. But I was so happy to be brought on board here. My background is really HR, programming, and working with volunteers. And that's my extensive experience in the field through the course of my tenure. I also served for quite a while as a legislative aide in Tallahassee. So I've had kind of an eclectic background. So when Mr. Brickfield called me, he said, I need somebody to come on board that knows our community, knows what services we need, and can help move that along. I said to him, do I need housing experience? And he said, no. I need somebody who's a connector. You can learn about housing. But I need somebody who can be out there in the community advocating for our tenants, setting up programs for our tenants, and really bringing life back to this agency. This agency, like a lot of agencies, kind of went dormant after COVID. And they tried really hard to bring programming back. It just couldn't be brought back. They tried really hard to bring a lot of developments online. That didn't happen for a myriad of reasons that you're familiar with when you read the newspapers. So a new team was brought on board after we had 3 interim directors. So you can see there was a lot of going on here that we needed a lot of stability. So in 2 years, we've had that stability. We've opened up a development that was delayed by Seminole almost 5 years because of NIMBYism. And it's called Valor Preserve. It is down the street in Seminole. Its primary population is veterans and disabled. And thank you, Kevin. I know that you are listening. We have a great partnership with BOLI out there. BOLI provides a lot of supportive services for those veterans and for the disabled. Our occupants. Hey, partner. We're looking forward also to bring BOLI on several other of our properties. They really do a stellar job. And in case you haven't been to a visit at any of the BOLI facilities, I'm sure Kevin can manage to coordinate that. It's really a great mission. We have about 98% capacity at Valor. Hardly any of our veterans leave there, any of our disabled leave there. It was opened about, I want to say, a year and a half ago now. And it really puts a lot of focus on those veterans and a focus on disabled who are not veterans. It's a beautiful facility. And if the CoC or the HLA ever wants to meet out there, we have a beautiful community room out there. We partner with the Elks Lodge out there. That is our most recent opening. We're having another opening in fall, and it is going to be in Heritage Oaks, which is in Ridgecrest, which is right down the street. If any of you are familiar with the old Rainbow Village, it is about 49 acres, and it was built up in the 60s and the 70s, and it shows. Our phase 1 was Heritage Oaks. We have taken down the older units, and we are building a high rise for seniors. We'll have approximately 84 units in there for seniors. We're very excited about that. Again, opening in the fall. It's a stunning facility, and I'm happy to give anybody a tour of that as well. And I'll make sure that everybody gets an invite to our grand opening sometime in the fall. If you tour that facility, we have arts and crafts room on the 2nd floor. The 3rd floor is the billiard room. I know, it was the developer's choice. So we're going to have fun out there putting programs on for our seniors. Those are our 2 most recent. I will tell you that Heritage Oaks was delayed 11 years. Not now. We are fast tracking. And we are trying to make sure that we bring as many developments online as possible. We currently own and operate 15 different developments. 3 of them are ALFs. 2 that we recently purchased. We purchased a center on Curlew, and we purchased another one called Evergreen, which is up the street kind of over by Felipe Park area. That one is more for memory care. That one houses a wide variety of memory care patients, and we're kind of learning our ropes with that. We have a management agency that advises us and helps us on that project. They'll help us on Curlew. The 3rd ALF is Magnolia Gardens. It has 100% occupancy. We have 1 veteran there who is, I believe, 100 years old. I'm trying to verify that. But that one is always full, always. And the management company that we partner and work with does a great job. So those are a smattering of our recent properties. Now we do have older properties. Remember I said Heritage Oaks is up the way here? Heritage Oaks is a 3-phase project. The first phase is Heritage, opens in the fall. The second phase is Ridgecrest, which we hope will open in 2027. That's also a high rise for seniors. That's the second one. When we get rid of the last of public housing at Rainbow Village. We are building for multifamily. It's gonna be garden style apartments. We're gonna have a couple apartments that are a little bit higher than 3 floors. So it's gonna be lovely out there. We're gonna have a huge community center, which is lacking in the Rainbow area. If you're not familiar with Rainbow, it operates in a food desert. It's hard to walk to grocery stores from there, and it's high crime. That's just the bottom line. We have 2 sheriffs that patrol every day out at Rainbow. So there is a need to get things moving there, and we have it moving. We have a total of 9 developments in the pipeline compared to 0 several years ago. We have 9 in the pipeline. 4 are fully funded. The other, we're in the process of seeking funding. And funding for the type of housing that the Housing Authority does can be stacked and layered. We can get funding county, from the state, from Florida Housing Coalition Corporation. So you have different varieties of funding and different varieties of different types of units you can put into your projects. Oh, I forgot, we just bought Portland. Anybody live in downtown St. Pete or near downtown St. Pete? We bought the Portland. The Portland is on the ramp going up 375. It's on the left-hand side. It's the high rise that is a block down from the St. Petersburg Free Clinic. And we have bought the ground, and we have leased out the building to a partner, but we manage the whole facility. We've had that exactly a month. So we're learning the ropes of that building and what comes with what was left over from the prior owner, which can sometimes be real fun. But we're growing, and we're growing very, very quickly because we know the need. We have a board of commissioners. They are appointed by the governor. And each one of them takes it very, very seriously, their gubernatorial appointmentship. And they have insisted that we make sure that we're out there and we're active in our community, not only being the face for housing, but trying to develop housing in our community. So we have a lot of different partners. We have other facilities as well, not only Valor and Rainbow. We have out in our community over 1,000 independent landlords. A lot of them are in South St. Pete. Just to give you an overview, HUD has gifted us 3,970 vouchers, and we have put on the street approximately 3,380 of them right now. And that's a pretty good number to be out on the street. And a lot of them are in our facilities, but a lot of them are with the independent landlords. We monitor those landlords. We do the very best we can to make sure that they're maintaining our standards and adhere to our mission. Our mission is to provide quality, affordable housing and to take care of our residents, provide them with services. So that's the bulk of our mission. So we're very proud of that. I was telling you earlier, and just kind of repeat, we're very proud of our VASH program. We have 2 stellar VASH coordinators, and we have approximately 585 VASH vouchers, and HUD gifted us 25 a couple months ago. We have all but the last 10 are out on the street trying to find housing. So VASH came out with a notice last week that we can apply for another boost to our vouchers, and we're going to do that.
Does VASH stand for?
Veterans Assistance Supportive Housing.
Thanks.
And it's in partnership with the Veterans Administration. So if veterans want to be on the VASH program, they have to go through, in our instance, Bay Pines, and work with those caseworkers. They provide great wraparound services for those veterans, and really hold housing authorities' feet to the fire to make sure that we're providing the kind of standards and quality of care that they need. And we absolutely do it. So if you know of any housing authorities that have VASH vouchers they're not using, they're free to go ahead and get in touch with us. We're happy to put them on the street immediately. We hold VASH briefings weekly. Just so we get those people waiting. In case somebody turns in their VASH voucher for some reason. Overall, we had on any given night, heads and beds, 8,300 people that we house. Out of that, I want to say about 3,000 of them are 18 and under. Of that 3,000, over 500 are 5 years and younger. We have seniors in our system. We have over 2,500 seniors. So you can see the bulk is made up from both ends of the continuum. And the rest are multifamily individuals. And it's really, it's an eclectic group. So we have here 85 people on staff. That includes everybody out on our 15 properties. And I oversee 65 of them. I have the biggest department back here. Their sole purpose is customer service and making sure that their caseload is taken care of. That those individuals do their annual certifications with their tenants. They get all the paperwork, they verify income, and make sure that these individuals are still within the income arena. Now the income arena for our area for a 1-bedroom, going off of memory here, is 21,900. Yep. And for a 2-bedroom is about 32,000. Yeah, is the income limit. So any kind of services we can provide for our tenants, we should be doing it, right? We should be. We should have health and wellness on our sites. We should have food pantries on our sites. We should have hygiene closets on our sites. Think about trying to take care of a family on $32,500 a year. Feed, clothe, get them going in the morning. I know I couldn't do it. And for a senior living on $21,900, no. But that's the income threshold that allows these people to be on our Section 8 voucher program. So that's why we're here. We're taking care of those that are underserved at the moment. And what we emphasize here is thereby the grace could go any one of us. Amen. So we take care of our tenants. We do our best to take care of our properties because that is our legacy. We tend not to sell our properties. We hold on to them. So they are legacy projects for us. I'm proud of what we do here. I'm proud of all the departments and everything that they do. I'm especially proud of people like Michael Flores. Michael is our programming director. And he has been brought on in the last several months to infuse a lot of energy into our programs for all of our properties. Not an easy task to do because every property is different. Every property has different demographics. And some people want to work and do the programs and others don't. Real quickly, do I have another minute to talk about partnerships?
Very much.
Okay. Again, we have a partnership with Foley. It's great. You heard about the partnership with Evera Healthcare. It's great. It's expanding. We had that grant from the Community Foundation in Tampa Bay. We were so proud of that. That helped to get the equipment in that room that looked so beautiful. We have a partnership with Boys and Girls Club. They are still out in Rainbow Village in the older section. They have a teen center and they have a youth center out there. We're extremely proud of our 60-year relationship with Lutheran Head Start. Head Start has been out at Rainbow Village since almost the day we opened our doors 60 years ago. We turned 60 in August. So we're very proud of that relationship. We have a lot of vendors, a lot of developers out there that we have really increased our footprint in the community. We love to partner with the county. We love to partner with all the different departments of the county. We think that that increases our momentum and increases our footprint and allows the county to increase theirs as well. Those are general partnerships that we have. The last thing we do is third-party management. We're not done. We own and we also manage outside properties because we do such a good job. So right now we manage a property in Lowman Heights that we're phasing out because it's going to be eventually transferred to Habitat for Humanity. So we do that with grace and dignity for our tenants that are still there. But we manage 2 other properties as well, the Portland downtown. And the third one is Orange Lake Village, which is owned by the Suncoast Connections. They have a big long name. And they have what they call older units out there. They're very small little bungalows and they're very nice. So we manage that as well. So we're looking to also do more managing because we know that that's our niche, it's our area of expertise. Any questions? Because I've talked fast, I talk with my hands, and I love what I'm doing.
Question online.
Okay.
It's Teresa Jones, that's her name.
Go ahead, Teresa.
Teresa, did you have a question?
I can hardly hear. I assume that you're saying Teresa?
We can hear you. That's good. Go ahead, Teresa.
Okay, so I have a comment and then a question. Comment is that I'm pleased to find out that the Pinellas County Housing Authority actually operates ALFs. I did not know that. I did not know that any housing authority had adult living facilities. So I'm glad to hear that. The question I have is related to occupancy rates and waiting list. I assume that for all of your facilities that I'm going to assume that you're very close, if not at 100% occupancy. And if that is correct, what's the average length of time on your waiting list?
Miss Teresa, thank you for asking. We don't dodge that wait list question because it serves to remind our community about the importance of housing. We have a 2-year wait on our waiting list. And we go through that waiting list routinely to make sure that we update it. But it has not been opened in quite a long while. And each property keeps their individual wait list because each property does different demographics. So we have a central office wait list and we also have individual property wait lists. So it is a dilemma and it's sad to say, but we don't dodge it. We know we need housing. And it's incumbent upon this whole community to accept that with grace and move it forward. Now your other question, because I tackled the tough one first, Miss Teresa.
Occupancy rate, yeah. she talked about
Occupancy, okay. When we did our tour next to our Pinellas Heights, which is our senior property, that is 100% occupancy. My occupancy report on Monday to senior leadership is for all 15 of our properties was 97.89 filled. So we work those occupancy numbers very, very hard to make them accurate. We don't have a lot of turnover unless somebody violates their voucher or violates their lease with their landlord. Our seniors stay forever and ever, amen. And we're happy to build on our success of Magnolia Gardens, which has 89% occupancy right now, which is our main ALF. It's the largest.
Good question. I have a question, Elise. First of all, thank you for all that phenomenal information. I have an interest in Rainbow Village. I
Yeah.
volunteered up there around there. And so we talked about the different phases. Have you removed more families? Because it seems like there's more seniors than what is already there, that you're not going to replace the new with as many family units. Is that right?
Okay, what we did in phase one
Mhm.
and now in phase two is we took those families and relocated them
Mhm.
and helped them relocate.
Okay.
They either got a Section 8 voucher
Mhm.
or they were able to stand on their own, picking a certain unit that they could afford.
Mhm.
That's number one. Number two, I would say the first two phases have really been a mix of seniors and families,
Okay.
probably more weighted to seniors. I can tell you the third phase, that we're trying to get that layered funding for, we still haven't gotten it yet. There's more families in that third phase,
Mhm.
because the third phase is, 3-bedroom, 4-bedroom.
Oh, wow.
Yeah.
Okay,
We have 4 bedrooms there.
good.
And these individuals are given a preference to come back onto the property
Mhm.
and to be considered for those units. So we try to build that in as well, but we provide relocation services.
Okay.
So we help them pack up, move, try and help them find an area that they can look in. We can't target it, but we can find a general area that they might wanna look at.
Okay, all right, good. And then, so it seems like there isn't, I'm older and I have my first grandchildren, but it seems like these housing developments are not, multi-generational so much, right?
Well, no, I'm not gonna accept that.
Okay, good, no.
Chair
Just
Beckman.
asking.
Chair Beckman.
Just asking for variety. you know.
No, the whole purpose of Rainbow Village is really to address the growing senior need in Pinellas County. That's why phase one, phase two are for seniors. But what we will do is integrate back in the multifamily concept in phase three. It will have a huge community center. I'm wrestling with a lot of ideas to get programming in that will appeal to both families and seniors and bring them together. We're always looking for those kind of partnerships. I can tell you that we have a lot of workforce housing going on, which has a lot of children and families in them. Again, it's just a wide variety.
Mhm. Good.
Mhm.
And I know the Ridgecrest Y is a good partner.
Yes.
there For often.
Yes.
Really catering to.
Mhm. Yep.
Good. And then I'm so glad you mentioned that it's about a 2-year wait list. And you've got that 97.8 build occupancy, that's great. One of the numbers that came out that I was learning about the, people who were referred and waiting and, queued up, so we have 91 families waiting with children, waiting for housing. We have 642 individuals who are not veterans, and we have 2 veteran families with children and 140 veterans. All people that have been touched by case management or evaluated social services waiting. That's huge.
It's huge.
It's just huge.
Yeah.
Yeah.
And it's a reflection of where we need to pay attention in our county.
But you all are doing amazing.
Thank
Thank
you.
you. Can you just comment one little bit more, and I'll look at the agenda on time. We're doing okay.
I'll talk fast.
The other housing authorities that may have vouchers,
Mhm.
why do you think they might be holding on to vouchers when you're ready to take them and get them?
Well, VASH vouchers, it could be they don't have a VASH coordinator. It could be they just don't have enough staffing in general, because that's a population you have to follow up on. You have to remain in touch with, you have to know them. And that's the neat thing about our VASH coordinators. They know each and every one of those over 500. They know them by name, they know their case, they know which ones they should call and which ones don't call but once a year. So it's a niche area in housing authorities. But we seem to have found our niche and we're happy to keep expanding that footprint.
Thank you for answering those questions. Yeah. Any other questions on her? Any questions here?
Yes, where does your funding mostly come from?
HUD.
So is it all from HUD or is there other?
We get funding from our administrative fees. Each voucher has an administrative fee attached to it that is paid by HUD and the federal government. So that's how we build up our reserves in order to do future developments, to staff up the building. Our budget is 75 million, of which over 45 million is vouchers. Yeah, so that is a huge amount. So we pay attention to what's going on in Tallahassee. We pay attention to what's going on in the county and also nationwide as well. We seem to think that we're in a good place nationally, but we'll wait and see. Yes.
You mean 45 million a year?
Mhm.
Also, do you work with Volunteers of America?
No, ma'am, we don't. But I know that Michael has met with that organization. We're thinking about partnering on some other programming that we have going on here. We have to be careful because of confidentiality. We have a lot of information that we retain on these tenants, and we always like to be respectful of who we bring on board and the situation we put them in as well.
Well, thank you, Elise. That was just phenomenal.
Thank you. Thank you for coming out. I'm so appreciative. You can see I have no passion. No passion. Thank you all for coming online as well. Welcome to Pinellas County Housing Authority, and you can feel free to get in touch with me at any time. I'm happy to help you with voucher questions, give you tours, and just talk about our mission.
Thank you. Thank you very much. All right, so our interim CEO of the Homeless Leadership Alliance, Gary, is going to give us a presentation of the PIT report, a brief overview.
Very brief. Well, yes, thank you for saying that because it will be brief. If you have seen, Dominique is laughing and there's reason. First off, I have a question. Are there any statisticians? Here? Okay, good. If there were, I'd tackle it, but, or at least not have them called upon just yet because all of our eyes glaze over. This is the actual report that came from, this is our PIT report. This is special to Pinellas County. This is not a requirement, it's something that we do, it's supported by the JWB, Juvenile Welfare Board. And we've had Dr. Freeman, who is also a CoC member, he's part of our Data and System Performance Committee and our Point in Time, which is PIT, Count Committee, Planning Committee as well. And so he's been doing this for the last 3 years, and the report is, so this looks daunting to read, okay, even if you are a data geek. But however, I'm just gonna flip through lots of charts and graphs and tables, okay? And most of it is raw data in the back. So if you are that type of person, we're not gonna judge you. Go ahead and please read this, okay? This is online at, on PinellasCoC.org. That is a newer, yes, PinellasCoC.org. You can find it there. You can also find, though, if this is not your cup of tea, the same, very similar information distilled in a digestible way. Read the report, though. It's right. It's a good report. Read it. And also, by the way, if you go online to read it, there's an extensive table of contents. You can click on the areas you want to read it. It's not meant, you don't have to read it front to back. And also there's an executive summary. So if you just read like the first few pages, you get a good overview of everything as well. However, there's also on, I believe we have copies of this here, but there's also on that same website, a shortened sheet, just an infographic that has all the basic information. Attach the agenda. And that website also, and the direct link is on the agenda. And then finally, there's an interactive dashboard on the website as well. So you can pull it up and you'll see the numbers in big, nice block letters, or numbers actually, but anyway, block font. And then you can click around and play with the data a little bit to go deeper into it. But initially it's very, very simple, nice layout, and then you can go deeper as you see fit. So I'm supposed to, like I said, I'm not the author of the pit report, so I'm going to do this in only 10 slides. And I'm not a lover of PowerPoint either, Elise. But I feel kind of that's our culture. So that's what we're going to do. And you can look at this up here as well and see what I'm saying. That way you don't have to look at me. That'd be nice too. So we can go to the next slide, please. Because we're going to talk about the purpose of the point in time count. It is a requirement by HUD, and we do receive our CoC Continuum of Care receives funding from HUD. And as a collaborative applicant, lead agency, and HMIS lead agency, we staff the CoC, of course. And so one of the requirements is that there be a biannual, so every 2 years, that the community gets together and we organize a point in time count, one night out of the year. And again, only every 2 years. Pinellas County, we are special. We create this nice report. We also do this every year. So it's conducted annually. And then we submit that information to HUD and we submit it, of course, internally. We analyze and it informs our strategic planning. It goes to Congress. It goes to the state to put together a homelessness report, which helps us with funding. It shows need and also improvements in how we're doing. So that is what we do. It also helps us know like where we need to target some funding or some more housing. And so like when Elise was talking about a lot of senior housing going online and that being a major area where you have young people and very much older people who are most directly affected by homelessness or housing instability, and that's where the target is happening. It aligns with the data that we're going to show. Okay. It includes jail data, school data, as well as the point in time count. Again, because Pinellas is special, we have added, so in addition to the point in time count, we do get school data and jail data. But I wanna just really quickly go over a couple terms, but also some things about like in this report and when I'm telling this information, it's not apples to apples. Okay, so for the point in time count, again, that's based on HUD requirements. And HUD, the Housing and Urban Development Agency, federal agency, they have literal category 1. So I'm going to get into technical language here. Category 1 homelessness means that you are literally homelessness. You are living somewhere that is not suitable for human habitation. So that could be on the street in a car, or you're in, and that's unsheltered homelessness. Or you're living in an emergency shelter, transitional housing situation, or a safe haven. And so that's sheltered homelessness. So it sounds a little odd hearing sheltered homelessness, but it's still homelessness. Okay, very temporary. That's for HUD and for the PIT count. So the housing inventory count is part of the PIT count as well. That's where we get our, like I said, our sheltered homelessness. And so that's what we call the HIC. All of the emergency shelters we have in the area, transitional housing and safe havens, we count up the number of beds and how many people, they say bodies to bed, how many people are in each bed to get that count, as well as the count that's on the street with volunteers who come together across the community. And then finally, with the school data. So this is where the apples to oranges comes in. PIT data is based on one night in the end of January, or one day at the end of January, based on this HUD criteria for homelessness. School data that we receive, and we also put in here in the report, is based on McKinney-Vento, which is a much broader definition for homelessness. And also it's a cumulative number. So you'll see like over 3,000 students, which is a huge issue that we need to address, of course. Qualified for services under McKinney-Vento of the school system. But that number is a cumulative across from August through the end of January versus the number of individuals that we're talking about the PIT count, which is only for one day out of the year. Okay, so I just not, when you see the numbers, make sure to keep that in mind so that, you know, it just gives it some more context. Okay. Overall findings. I am gonna get my cheat sheet. Overall findings, for the sheltered homelessness population, there were 1,325 people in one day. For the unsheltered, there were 538 that day, for a total of 1,863. And then for the Pinellas County Jail, which also, by the way, it does follow HUD definitions for that day, 125. So those were people who on that day did not have a place to live before that, and were not in the jail for they were in jail for less than 90 days. And then Pinellas County Schools at the McKinney-Vento from August 10th through January 27th, there were 3,623 students who had experienced McKinney-Vento type homelessness. So that could be doubled up, living with having instability going on. And so now I'm going to just focus on just the pit count itself and that information. So with those people, with the number of people that we, the 1,863 who experienced homelessness, that was a drop. That was the lowest recorded since we started the pit count. And there's some reasons for that, the potential reasons. So we don't know exactly which reason is what. It's probably a combination of all factors. So 29% were sheltered and 71% were unsheltered. And the unsheltered number was a 25% drop from last year. We get 253 veterans were included in this, 189 survivors of domestic violence, and 494 people experienced chronic homelessness. And that was chronic homelessness means that you have been homeless for 12 consecutive months, or within the last 4 years, there's been 3 times that you experienced homelessness, and it adds up to 12 months, according to HUD. But it's consistently, if we were to, we're going to talk about some of the reasons why this may be, but consistently since 2016, there has been, I did not put the pretty line graph, and I tried. But it was going to get much longer. Since 2016, it's been coming down. As COVID, we noticed, and I can say, like, outside of the pit count, when we look at our information, so the homeless management information system, which is all the services that participate, all the providers who participate within our continuum of care, enter data into that system, then we have noticed significant drops happening especially since COVID. Like, people had left, were displaced, possibly, we don't know, and have not come back into the system. So that is it's just an interesting detail. But some of the reasons that when we really went into the data, so we all know about bias, and I'm talking about data bias, okay, statistical bias. So when you come up with your hypothesis of why something might be, it's very easy for us to come up with the obvious answers that we just assumed are true and stick with that. And then you start getting more brains involved and you realize, oh, there's different perspectives here. There are more things that have happened. So initially it's the anti-camping bill. And that probably did play a part. We do know that people were, there were a number of people who did stop the survey, did not complete it, did not want to talk about where they stayed the night before, because that is one of the questions on the survey. Out of fear that maybe, we'll be told that we have to leave, right? So there's that. There's also people may have been pushed out further. They're not into the woods. I'll just say they pushed out further and out of visible distance, so that our volunteers may not have even known where to go. However, we do have a lot of street outreach workers and people who do have connections, and lots of providers are involved in the pit count. And so they do know how to reach people and they have that connection. And so that's something to keep in mind too. But another reason, we had hurricanes, displacement, we had FEMA, the TSA vouchers. So those were the vouchers to help people with hotels. And we don't know. We've tried to get data from FEMA. We've even engaged with HUD technical assistance for a while and said, hey, that's one thing we could use. who's in the hotel? What's going to happen? Waiting for a tsunami of people after both hurricanes hit us all at once, right? That we would have a lot of people who are experiencing homelessness after that, and we just haven't seen a large uptick from that. And but we were monitoring it. There was some, like 8% of people it was related to disaster, natural disaster at some point in time. Another reason that could have led to lower count this year is that we had 122 fewer volunteers than we did last year. So last year we had around 400, this year we had around 300. When we dug into this, that's thinking about this though. We were looking at last year versus this year. When we dug a little bit deeper into the data, we realized last year was more the anomaly with a higher number of volunteers. When we looked previous years, it didn't really, so last year was the big anomaly. But there was, we do want more and more volunteers and to participate. This is a community building as much as it is data collection, because it's a way to get with neighbors, with people who you may not otherwise meet, and develop a connection. And so I find that one of the biggest highlights of the pet count and participating in it. It can shatter those myths and those stereotypes about people who are unhoused. But let's talk about some of the good things. One good thing that may be a reason also that we have shown, because you know what, it's not always about, oh, the data must be bad if it's, if we're showing improvement. We also received a lot more funding, so a lot more prevention dollars are out there, more diversion dollars, more rapid rehousing dollars, significant increases in funding in the last year and a half. And that's just from the state alone going through the Homeless Leadership Alliance. There has been we went from $150,000 in, I'll give an example, in challenge funding, which is pretty open to whatever we see as a need, to like last year, almost about 900,000. So that was a big jump. And so those have been out for the last year and a half. Okay, and so those have increased services. And that is just with us. That is not including what the county has also provided in the city of St. Pete and other cities, City of Largo. And so those are things to keep in mind too, that maybe we're doing something right. Okay, maybe it's all of it. It probably is. So for population trends, again, like Elise was talking about earlier, the seniors, the number, so I didn't put the N, but there are no statisticians around here, so that's okay. But the count, if you, again, go back to the report and you can look all this up, but we did see an increase in seniors, especially just for the unsheltered population. It went up 23% and went down a little bit in the sheltered population. For veterans, there was an increase for both unsheltered and sheltered. 8% sheltered, 10% unsheltered. We are seeing predominantly male across the board, and so that was 76% of the people who were surveyed were unsheltered, and 62% were sheltered. And definitely seeing disproportionality with Black African American families, 76% of sheltered families, and there's two different, so they're combined here. 76% of sheltered families, and then 38% of the homeless population were Black or African American. Going to the families who are sheltered, some of this could be potentially a response to zip codes that have been, where there's been targeted outreach and most need that happen to be predominantly Black and African American. So if we see more people who are in shelter, and I won't go beyond that explanation, but that is something to consider. But 38% of the homeless population, when we're talking about 11% of the entire population of Pinellas County, in comparison. And then 41% of homeless students are Black or African American, according to school data. Primary causes. What are some primary causes you think of?
Family. Family.
Family.
Medical.
Bills, unexpected.
What are we hearing in the unexpected medical bills? I hear that.
Job loss.
Job loss.
Mental health.
Mental health and substance use.
Increase in drugs.
Increase in rent. I think anyone who's renting right now can attest that that is a major problem. Okay, so it's interesting, reading news reports, reading about a lot of the fixes that some people are coming up with, policymakers. What the data show is that financial issues and job loss was number one, 40%. Medical issues, 20%. I should keep my glasses on. Family issues, 14%. Eviction or foreclosure, 10%. And then I left off natural disaster as the fifth cause, 8%. Start talking about, for the primary reason for homelessness, there are plenty of people with mental health issues and substance use issues who are still housed. It is not the primary, it's not up there. It's very interesting.
Sherry, don't you think it's interesting that if you go back to that last one, like financial and eviction, I mean, and financial could be, you know, the rent went up, and so now I'm facing eviction or foreclosure or something.
Right.
Because I can't make payments.
Or-
some of those questions that we ask with the pet, it's, they could fall into either or categories, and you don't get into some great big Q&A with your interviewee.
Right, the survey is developed, and it's fairly lengthy at this time. And by the way, in a moment, I'm gonna introduce you to Dominique, because she's our chair of our pit planning committee, and just make sure that you reach out to her, or us, if you want to join. That's what I would say. But one of the things also with the financial aspect is that when you go fill out a rent application, we talk about the Alice report, which is a good thing to look at. When we look at the area median income, what a family or a single, what people actually make who work in Pinellas County versus how much it costs to pay for rent in Pinellas County, the math doesn't add up. It just doesn't logic anymore. And so when you fill out your application for rent, to a lot of places will not take you if you do not make, like, they'll only allow you up to 30% of your total salary, which you're bringing home. There are many people who are living, spending at least 50%, and that's not even the lower income. 50% of their salary income is going towards their housing. That is not sustainable. So that would fit under that as well. So even being able to qualify for a house, or for, when I say house, I mean any apartment, studio, anything. 3 times the rent. 3 times the rent is what you have to make. And if not, then you are really living on the edge. So Dr. Freeman, he listed some recommendations, and these are the 7, like the bullet points of them, and underneath each recommendation, he had a list of more specific things to look at. And so they're really around best practices related to what was found in the report. But we noticed that some of the things we are doing, or when I say we as a community, we have in place. We want to make sure that when we do strategic planning, we continue and keep, leverage that and improve it, and not throw that out just to look at what we're not doing. So we're meeting with the federal, well, I think I'm gonna get in that in just a second. So some of the recommendations are, I cannot do that up there. One, monitor disparities. I talked about that earlier. Align government efforts, build research or evaluation framework. So like, again, a lot of this we do create a PIT report. We fund a PIT report every year that does a pretty deep analysis. And we also have our HMIS, and we have our data system performance committee, and they review a lot of data and request questions. And our CoC in general tends to ask a lot of questions around data with our coordinated entry system and our entire system. So we're building that up. I do want to make a plug for a dashboard that's on the HLA's website. That's on pinellashomeless.org. So if you're that data geek, go in there and look. It's up to date from our information system. Strengthen nonprofit capacity. Elise, you're talking about how staff can get in the way. And we all know after COVID, staffing issues can get in the way, like not having, when your workforce can't afford to live where they work. And if you're a nonprofit, that could be difficult to attract people. We're also living in an age where people can work remotely from anywhere. And so since COVID, I think all industries have experienced that, especially the nonprofit sector. So that's looking at that as an important one. Coordinate with the justice system, which we do have a very good partnership with Pinellas County Sheriff's Office and other police departments throughout the system of care here. Even with the Pinellas County Sheriff's Office has a seat on the board of directors. Improve PIT methodology, and he listed some areas to look at with that, and advance shared system priorities. Looking at healthcare, schools, the homeless system, the child welfare system, and we know with all these different systems, it can be very difficult to get. We try to get together. We talk about integration, and that's long, labor-intensive work that's important. Otherwise, we just exist in silos, and so anything we can do to work together is going to yield some big benefits. And then, so what's next? That list of recommendations that Freeman put in his report, we have created a survey. We sent it out to all of our providers and funders so far, and they are going through and checkboxing, like we are doing this and describing what is exactly. So we're like, it's basically mapping our system and what are we doing well, and then what are we not, what's lacking, what's missing here that we need to look at. And this will all, once we compile all that information, which has already been received, and now we're going to talk about it on Friday's joint councils meeting. Once we do that, there will be more opportunities to, we're going to take it through different committees and with the CoC, and this will inform our strategic planning. So he really set us up in this report based on Kathleen's request, actually. So that was nice, good planning. Based on this report, to have a list of areas to really target, and then we can go from there, whittle it down, and decide what is it that in the long term and the short term that we can actually realistically devote our focus to, so we can get some good things done. So to get involved, this is going to bleed into the next part of our agenda. Join the PIT Planning Committee. Dominique is the chair. Would you like to say a word?
Am I transitioning too? Or wait,
Almost transition.
okay, I'm gonna go ahead and move up here so everyone doesn't have to crick their neck. All right, I'll try and speak up. So, point in time, I did a presentation for my department as well, and so I really wanted to feature like 2-3 more things. So I apologize. I'm a data dangerous. I'm not a data geek or nerd, but less than 0.2% of the overall Pinellas population experience homelessness. Like you saw the number 1,800-ish, so 2,000 people, less than 2,000 in a community that's a little under 1 million. But 4% of students are experiencing homelessness, and those are only students that are in public education, so kindergarten through before they turn 18. Doesn't include the private, the preschools, the daycares, all of those students as well. So just wanted to kind of stress that. Also, our community has the highest number of veterans in the state of Florida. There is a state report that has already been published. HUD's report probably won't be out till Christmas, December time is typically when theirs comes out, but the state report has been published, and we are double Miami-Dade and the highest in the state. So I think that's really a relevant, important topic to bring to attention. And then recruitment, that's really why she asked me to come up here. So the point in time committee meets monthly from August to about February time to really kind of gear up towards this event that is happening in the last 10 days of January. Our next meeting is taking place on September 2nd. It is the first Tuesday of every month from 9:30 to 11. So it is during the morning hours for those of you who have other jobs and may not be able to join us. But we also have subcommittees and plenty of opportunities as we get closer to those, trying to make positive change and get an accurate count, as we heard so beautifully, eloquently stated earlier today. So I will just emphasize that we have some great subcommittees. We're really looking at trying to get some attention into one of our subcommittees, which is a first responder subcommittee. So the fire, the police, and what their response is. We had great participation from law enforcement this past year to count those who are unhoused. And then also we do some youth targeted initiatives. We look at how can this survey be adapted? Is the survey too much? What are the right questions to ask? And there's some other subcommittees as part of that as well. So I highly encourage anyone that wants to join us. Let me know. I am the chair again this year, so thank you.
Chair again this year. Very glad to do this. We also have our secretary here, Clara. I just want to say that there's another officer. And the vice chair is April White. She works with the city of St. Pete. She's street outreach.
And Joni, those meetings are hybrid, right? He didn't.
Correct. Yes, all those meetings are hybrid.
Yeah, you can join online as well and participate. Also, in January, when the call goes out and it's time that we need volunteers, please volunteer. And you don't have to go all day. They're reasonable sections throughout the day and throughout the county. Also let your family, your friends, networks, everyone know about it. The more volunteers we have, the better data we have, and the more that informs what we need to do in response. So I believe that is the end of, that's all I had there, right? Are there any questions?
Do you think that the number of females is accurately represented, seeing as how a lot of females don't really want to get that information? And like when they're being put on the spot, like if they have children with them or something. Does that make sense?
That does, I haven't thought about it that way. I can say though that PIT data, that is, somebody coming up and saying, I have, are you willing to take the survey? And I have this incentive, a gift card or bus pass. But in our HMIS, one of the things that we do notice is that there is, with the unsheltered to chronic homeless population, it tends to be white male and black male.
Okay.
So that's it tends to be male.
Yeah.
And we have as a county been fortunately, because there aren't a lot of family shelter, there's just not a lot of family shelter beds available or units, that we have a process in place to try to prioritize and based on vulnerability, families getting into emergency shelter. We don't have that same process for individual shelter, and it's because of the options available that there is, Safe Harbor does have 24/7 basically, but it's just not it hasn't been until recently it was created. It's a priority in the population now, but not as much emphasis because of the families and young children.
Well, and also I'm asking this based on personal experience and from many, many women that I've spoken to that have also been homeless, that there's not any safety in going to shelters.
That is something that we do hear back in
Yeah.
our surveys too, and discussions. We have a lived experience advisory committee, several members here today, and that is something that definitely has been submitted. Aside from survivors of domestic violence, of course, we have CoC and Hope Villages.
Okay. I just didn't know how you got an accurate count of the females.
If anyone, so that's an interesting question though. I mean, it hasn't been something that's really been, I haven't heard it asked yet in the different forums, but that'll be something that we can look at going forward with the next bit.
Sort of building on that more generally, like what is the procedure for identifying where you're going to find people who are unhoused or homeless?
Deployment.
Okay. So there is a deployment subcommittee. And that is primarily made up of a lot of our street outreach teams and just community providers that engage on the street, not at facility or location. That committee has been kind of headed by Dana Kelly with Bully Centers the past few years, and teams will come together. They'll identify the hot spots. That will also look at some local law enforcement data and kind of review and have an idea of where they are, where they're going. And that's also put into our deployment. So when you volunteer at point in time, you're given either a north, mid, south county location. You go to that hub and then you're sent out from that hub. We're also not going to send volunteers into encampments or into the woods. So either trained staff or law enforcement are going into those locations to try and survey those. We're also going into libraries, respite centers, all of those locations. We're always willing to identify and strategize new ways. One thing I've thrown out the past couple of years is the librarians. She's wearing a dress with books all over it, so I assumed. But with librarians, you know, having someone at every library that's trained, that knows the population coming in every time, or, you know, a location that bus stop or something like that. So we're always looking at different ways to engage and find those. But really, it is a census, essentially. It is a census of those who are unsheltered. So it's only going to be as good as those who participate and those we engage to get the numbers and the responses back.
That's very, very thorough. Thank you.
Any other questions, Bob? Anything else?
Any questions online?
I actually have a comment about the HMIS to let people know that not just anybody has access to that.
Right.
So that could be something that could be, you know, twined into like the survey, like this information that you give is confidential, you know. So yeah, like no, I remember because I'm a lived experience committee member, and that was brought up that, you know, only a certain number of people have access to that. So just thought that out there.
Like a privacy policy. You know,
Yeah.
Yes, our HMIS administrators like over my dead body. Basically.
I had a couple things. I appreciate your question about an accurate count, especially related to women. And I'm not any expert, you know, I serve as chair of the board, but I've never worked in that social service field, but I have been a public school teacher, and I think, I worry that there are a lot of children, and women, families that are experiencing homelessness that go uncounted. And I think you used the word like an accurate count. I think the way I try to look at it is it's not an accurate count, it's a general count. It's what we got on that day and what people chose to answer and all those things. So it's not in stone, I don't think ever. But I do worry about the kids that are doubled up and in private schools or other places that we're not counting them. And one thing that strikes me about the school data from the Pinellas County schools, again, just our public schools, is that we see more people that identify as Hispanic there than we do anywhere else. And so I think, you know, I think, and I hope our families feel safe in our public schools. And that they're able to confide in. Now, not all of them will, because I would, you know, you're still afraid that your kids might be taken away from you or something. Or who's gonna find out or whatever, but at least there's some level of safety there that they're reaching out for help. So I think that's important. The other thing I would say is, I think this PIP report is the best I've seen. So I've only been engaged with a CoC for about 5 years. It just keeps getting better and better. And the recommendations that Dr. Freeman Gerhardt recommended, we asked that he could, like, I think last year there was maybe a half a page of recommendations, kind of like a sentence each. This year, there were 7 pages. So you got those 7 boxes. Oh, we're gonna do something else. Oh, okay. There were those 7 boxes, but each box, each title
had at least a page. And he broke them down into short-term goals, like within a year, and then long-term within 5 years. And they are fascinating. And I think when we presented the PIP report to the board of directors, they were really excited about those recommendations, how they were categorized, how in-depth they were. We're doing, as Sherry said, we're already doing some things. What can we build on? What are aspirational? They're all best practices. So on Friday's meeting with the funders and providers, they've been asked to kind of comment on those. Which ones do you think we're doing? Which rise to the top? All that stuff. So we can't do everything. But that's why I would encourage you and anyone online, read the introduction to the report, read the discussion. It's like 3 pages at the end. It's all in the table of contents. And then look at those 7 pages or so of recommendations and ask yourself, what can I do? What speaks to me? Where do I want to can I put my energy? What do I think is most important? And, see how you want to step up and join us in this work, because it's a lot and it's really exciting, the possibilities and the ways we can really improve our systems of care.
Thank you very much.
Yeah.
Thank you.
I'll also add that there is a training plan for all the volunteers too. And like Dominique said, street outreach work, there are people who are, who have relationships, the providers who have relationships with people too. So that there's nothing to replace that. Having a stranger walk up to you and say, hey, I want, I have some questions.
Great.
So yeah, so that does exist, but for everyone who does volunteer with PIT, when going through the training, we do talk about, I went through the training and you do talk about how you ask your questions, how not to be pushy, how to approach.
Yeah.
As well as, the safety considerations and all of that.
And
So-
you don't go out alone. You've got a partner, a group, and a team lead and all that stuff.
Thank you.
So we all good with that? All good? Okay, thank you, Sherry. That's great. I'm just gonna give you one one more thing. Oh, sorry.
This is what I was asking, if this is what I was supposed to be doing, yeah.
Okay.
Okay, so as part of our point in time committee this past year, some members wanted to take the opportunity to recognize community partners and some agencies and individuals that have really stepped up and represented point in time throughout their kind of day-to-day experience. So we wanted to take a moment and just read and acknowledge some people. I think most of them are on virtually. So thank you for your patience. So our first award that we just chose to give is the Point in Time Championship Award. This award is given to Kevin Marone with the Bowley Centers. So there were some very strong opinions about his selection. So the 2025 Point in Time Planning Committee unanimously voted to honor Kevin with the Point in Time Championship Award. This award is given to a member of the CoC or the HLA Board of Directors who demonstrates consistent dedication to Pinellas Point in Time Count. Mr. Marone is not only the president and CEO of Bowley Centers, but also serves as the chair of the CoC Providers Council, which he represents on the CoC Board of Directors Executive Committee. One of the main reasons for us choosing to acknowledge him with the recommendation was that as an executive, he had a very competitive spirit on the day of to really get out there and engage with those who are unhoused. He was aiming for the most surveys of the day, did not accomplish that. But from an executive level staff to be hands in, doing the work day to day, and also how he empowers his staff to do it all season long is why Kevin was selected for that. I don't know, do we want to give them? Kevin, did you want to say anything? You don't have to, but now that I put you on the spot.
I appreciate the recognition. I know I'm among a lot of peers on this call that have been champions of this. I've been doing the pit for a long time. It's exciting to see where it's transitioned from to an electronic survey. And it's really an important work that we do. It's been highlighted in some of the discussions earlier, just what happens with this data. And I think the reason I just stay connected to it and champion it so much is because if we don't do a solid effort as a community, then we don't do the justice and tell the story that's necessary with this data. So it's really important. And I think it also it just keeps you really grounded to the mission and the work that we're doing when you carve out hours of your day to go out there and particularly when I'm in a role like mine where I'm not doing this anymore in my everyday stuff. So I just feel it's really important to keep me grounded to the mission of the work. Thank you to you, Dominique, and the HLA staff who have really grabbed a hold of this as well and moved it along. So I think we're doing a fantastic job as a team with our pit every year. Probably I can't imagine there's another COC that's as rooted and strong in this approach as us.
All right, well, I'll move on to the next one, you guys. So thank you, and congratulations. So next we have our point in time volunteer champion, and this is actually being awarded to the city of St. Pete. The city. The city of St. Pete is being honored with the Point in Time Volunteer Champion Award. This award is given to an agency organization that recruited the highest number of volunteers for the 2025 Point in Time count. City contributed volunteers from law enforcement, water, fire, parking, transportation, housing, community resources for a total of 24 participants. So congratulations. A little jealous because closely behind was myself with Pinellas County. And then the VA also was very close. So I just wanted to acknowledge that. Helen, I think, is accepting on behalf of the city. Her team is the champion with that recruitment. So thank you, Helen.
Thank you. We appreciate it. This is really much to Kevin's point. I would say this is something that is near and dear to my heart. It's how I started in this world, was going out in 2010 and doing the point in time and really recognizing that I love this work. And so my colleagues are probably tired of all my emails that they get, but they get a lot of them from me, strongly encouraging them. Sometimes I knock on doors and encourage them to just join us. It really, I think, I don't know another way to say it, kind of like humanizes like this. These are people that we're working with every single day. And so it kind of allows them to take time out of their workday and, have some conversations with our neighbors that they probably wouldn't have otherwise. So thank you so much from the city. We appreciate you all. And so I'm competitive too, Dominique. So we're ready next year too.
All right. Yeah, I was a little bummed, but now I should say that was trained deployed. So a lot of people, will sign up and then they don't go. It was 24 that actually deployed and went out and did a time. So thank you again. All right. Our next recognition is for the Point in Time Survey Champion. And this is going to Miss Kathy Ham with the City of Clearwater. So, like I said, Kevin was pretty competitive, but the Kathy pulled ahead. Kathy Ham is being honored with the Point in Time Pit Survey Champion Award. This award is given to the individual that completed the highest number of surveys during the 2025 Point in Time count. Miss Ham completed an incredible total of 50 surveys within a 13-hour chunk of the day. So that, just to put in perspective, remember, I think it was 538. So really that's 1 to 2 per person. Kathy had 50. So, okay. Wow. So Kathy, I don't know if you're still on, if you want to say anything. No.
Hi, everyone. And thank you guys. I think this, I appreciate the award, and I also want to say that this is a big testament to the efforts of street outreach, having consistent people, and the efforts of law enforcement to be out there working closely in a positive light, and not a negative connotation to the community, and how much they entrust when they are apprehensive about speaking to someone and are volunteers that they don't know, but willing to speak to someone that they are familiar with. So, we appreciate it. And of course, competitive, we're going to get out there and try to do it again next year, and reach as many people as we can, because at the end of the day, it is about the people that are out there on the street, our neighbors that are unhoused, getting notice to everyone, and services coming in and funding to make sure that we can provide housing and just all the support that they need to try to get them back on their feet. And back in the communities, living in homes, where they were before. So love the work. Glad to be out here with everyone, and we'll get out there and we'll do it again this coming year. Okay.
Thank you, Kathy. All right. And our last award is actually our point in time training champion. And honestly, it's because we weren't able to create another award, maybe next year, but we are choosing to honor Victoria Kelly. Victoria Kelly previously worked with Pinellas County, or excuse me, with the Homeless Leadership Alliance of Pinellas. Victoria Kelly is being honored with the Point in Time Training Champion Award. This award is given to the Point in Time Planning Committee member who's led the highest number of training sessions ahead of the 2025 Point Time. Besides hours spent leading live training, Ms. Kelly developed and recorded comprehensive on-demand training videos. The reason why we decided with Victoria is she literally was in everyone's training and video recording. But she also, for those who did the online, for those who there were some recorded trainings as well. Victoria really was a champion throughout the point in time process the past few years. So we chose to acknowledge her. She was not able to join us today, I do not believe. She's actually on vacation, living it up. So, but thank you everyone for putting up with my awards. I think they're gonna move forward with something like this in the years future. So I just want to take a moment to acknowledge. Thank you.
All good? All right, so, one part of our agenda is doing some public comment, which we welcome public comment throughout, as well. Our different, opportunities to get involved with our CoC. So, it's a continuum, along a continuum of care. It's a coalition focused on ending homelessness, reducing, preventing homelessness in the county. There are, I think, 24 within the state. Ours is just our county because we're so densely populated. Some others are multiple counties. Our vision we went over is to make homelessness rare, brief, and a one-time event. And the big challenge is to coordinate all these different members that have a stake or an interest or touch the lives of those who are on the edge of homelessness or experiencing homelessness or are housed but need wraparound services. There's all sorts of needs out there and coordination that's necessary. And then who are the members? Individuals and agencies that live, work, or attend school in or serve Pinellas County who are dedicated. So one of my goals is to try to, and I've been working on it, is engage more faith-based organizations. They don't necessarily have state or federal funding that comes down to them that gets cut and is threatened. And they're touching the lives of their parishioners or people in their neighborhood every day. And, they're spread throughout the county. So I think there's some untapped synergy and work that we can do together with some faith-based organizations. I've got meetings with FAST and Faith in Florida, who are some organizations that coordinate with other congregations. But the bottom line is anyone can be a member. Any person can be a member. We have membership fees. I think it's $0 if you've got lived experience. It might be $10 a year for just a person who lives in the county. But whatever the membership fee is, if you need a scholarship or you need financial support, just reach out to the HLA and we can make membership happen.
We really just need you at the table. And then we need you in the committees. So these general membership meetings are great. You get to learn about work and organizations that are involved in the CoC. But the real work gets done in a committee. And you need to think about joining a committee. Most of them meet hybrid, at least. I know our lived experience advisory committee is only.
It's only in person
only in
unless
person.
unless there's a accommodation made.
Yeah, but anyway, it's not bad to attend that one. But most of them have a hybrid option. But that's where all the work gets done, and that's where your ideas get fleshed out and responded to and shaped, and people take on different projects and research and investigation, and that's where we need, that's where your opportunity to really lend your voice and expertise happens. So, we have the board of directors, which it's dictated what those seats are. We have right now an open business seat, so we need someone from the business community to fill that seat. It would be nice if it were somebody from a chamber of commerce. I like to be intentional with having diversity on our board, from geographical, from age, from all sorts of demographics, but we have a lot of engagement of people from south of Wilmerton. I'd like to have a little bit more engagement from North County as well. So I want to try to be intentional that way. But our board of directors, I think Sherry talked about it, and Elise maybe referenced it, but public defender's office, the sheriff's department, providers, funders, nonprofits, religious, there's a seat that represents the religious community, entitlement communities, so those are the larger cities that get federal funding or state funding, so Largo, Pinellas Park, St. Pete, and Clearwater are there, have representatives. The county has a county commissioner that sits on the board, and so it's a real eclectic group of experts, and these are people that, you know, are at the CEO level, and they are the decision makers, so it's a real good board. Pinellas County Schools, Laura Hines sits on our board. And then the executive committee is, we have up to 7 members who serve on the executive committee, and it's all prescribed in our charter. And so I am part of the executive committee as the chair of the board. Our vice chair is Deborah Fix Sanders, who's a council member on St. Pete. We have Kevin Marone is on the board. He's the CEO and president of Foley Centers. April Lott, CEO of Directions for Living. We have an open seat for a funder. It's really been a challenge to get a funder to chair the funders committee for a variety of reasons. And then we have a lived experience member who sits on the executive committee. And then myself. But there are other committees. These are the committees that you can attend any meeting, you know, and so there's a funders council that advises the CoC board on funding of homelessness and at risk. So this mostly is governmental agencies, but it's also the Juvenile Welfare Board, JWB. It was the Pinellas Community Foundation. Doug and Cooley was on it for a while. They can provide funding, and then the county and the municipalities that help fund the work. The Providers Council can be huge. Again, it's anyone who provides services. So, you know, it could be, it's Directions for Living, it's Foley, it's the county, it's well, HLA, you wanna go through?
I was gonna say, any provider agency that provides services and enters into
HMIS, right, that's right, that's the stipulation, right. So St. Vincent de
the
Paul,
homeless management information system.
so it's a database where we can log who's receiving services and what type and where, just so we can keep accurate information about who we're not reaching, who is being touched, who falls out of the system, not like the who, but how many, and, you know.
Yeah.
Providers would be, you know, Safe Harbor is one as well.
and Pinellas Hope. And then, the leadership, the Funders Council is Vice Chair Era Woodard, with the City of Largo. She's phenomenal. And Providers Council has, Kevin Marone with Foley Centers, and April Lott is the Vice Chair with, Directions for Living, two very large providers in the county. And then we have the Advocacy Committee, and I happen to chair that with Anne Marie Winter, who is the CEO of the Area Agency on Aging. And we're using data and research to advocate to policymakers about priorities of our continuum of care. So ideally, we develop a one-pager with our goals and asks, meet with legislators, decision makers, let them know about the CoC, what we're doing, what our numbers show, where the successes are, and just advocate for more funding, essentially. There are other things that we can speak on as well, but there's a procedure. This isn't just a rogue group that goes out and advocates. There's approval, they have to form an executive committee and approval from the board and all that stuff. It's not just, everything's coordinated. Data and system performance coordinates the homeless management information system, that HMIS system that I think Jennifer and Sherry mentioned. So if you're a provider and you're part of the CoC, you have to enter in your information into that system. And you have to pay for a license for HMIS. And that's a funding thing too. And, that's another way or reason we can advocate for funding, is so that we have coordinated data, good data, and that cost agencies money, which, it's, okay. And then the Lived Experience Advisory Committee advises the CoC board on services, programs, and the needs and concerns of individuals who have experienced or are experiencing homelessness. And that's a very active committee that meets once a month. We have a member here. Jennifer, do you want to speak at all to that committee and what you do? I didn't want to put you on the spot if you want to, because you've been involved for a long time.
Yeah, I've been with the Lived Experience Advisory Committee. I hope it's okay if I sit. For actually since its really inception, back in June of 2023, and we talk about the different shelters, the lack of services. The new law, the HB 1365, was a really big part of our meeting, and I like to give congratulations or for Kathleen or Kat, or she's our secretary. She's actually the one that came up with our the law enforcement pamphlet.
Oh, yeah.
For how to interact, and we just are trying to, do our best to get one. I think our meeting on Thursday, we're going to talk about storytelling.
Yes.
And to help destigmatize
Yes.
the unhoused, and we're just doing our best to get the word out there and make changes and put the resources where they need to be.
Excellent. Yeah, it is an exciting move. It is. And all the data that Sherry went over in that PIT report has 140 pages or whatever it is. I've come to learn that it's the stories that really can move the needle or get people to pay attention. And so the Lived Experience Advisory Committee is going to work on storytelling starting this Thursday. And it's at what's the name of that library?
Barbara
Ponce.
Yes,
Barbara
It's
77.
If anybody needs,
Yeah.
it's on my business card.
Yeah.
77, 70, 52nd Street, Pinellas Park.
There you
got
go.
it.
That's right.
Conveniently located right off of 19 and Park Street.
Right.
That's on your dress?
Yes.
Oh, that's amazing. That's wonderful. It is a great location. Yeah. So the Lived Experience Advisory Committee meets regularly. It grows, I think, almost each meeting, but you have a solid, I don't know, what do you have, like 17, 15 people in there, each month, I think?
Yeah.
It's a good group.
And then the point in time planning, committee, Dominique went through that. And I missed the first meeting, which was last week, we had company, but I will be there at the September 2nd meeting for sure. And, interested in learning more about those subcommittees and all that. So it's a big effort, so I encourage you to join that one. And then the Systems Disparities and Inequities Task Force advises the CoC board on how to address identified gaps. And that's kind of been rolled into our DSP. And we're just looking at data, and then we're looking at discrepancies in data and how are we going to address those. And so right now we're looking at, is the DSP, Data System Performance Committee, going to change in the number of seats or all that stuff? So that's being discussed and more to come on that. But we always look at data and the performance and where we see disparities and what do those tell us? Why did they happen? How are we going to address it? What does it mean? Yeah. And is that it for all? Okay. So different types of members, I don't need to read through all of this.
Anyone can be a member.
Yeah, anybody can be.
With a shared vision of ending.
As long as
Yeah,
that.
yeah. Right, thank you, that's right, with a shared vision to end it. And to treat people with dignity and to listen, just to really listen. And, yeah, I'm proud that we have a lived experience advisory committee member on our board of directors and the executive committee. And it's been consistent and it's been great to
We
have
had
it.
two on the board of directors, actually.
Yeah.
And one on executive committee. Yeah. Two.
Okay. So, any questions about membership? No. How many of you are not members yet? Okay. It'd be nice if you joined. I'd love to have you, but I'm telling you, I think that you look at that PIT report, you go online, look at it, you don't have to print it out. But you look at those recommendations and see if it just sparks something in there, cause I think there will be something within those 7 categories that will be like, I've got experience with that. I know how, I've got some ideas. I'd like to do that. And I think it'd be great. So I will, share. Anything I missed?
That's it. I would just, the only thing to add, is that the Florida conference is coming, so is that?
Oh, that. Okay.
The Florida Coalition to End Homelessness, it is an open conference. It's happening in October. And so if you look on the website for CFC and you have signed up for any of our newsletters or email blasts, you'll get this announcement as well. It's good. It's in Orlando. It's nearby. So
Lots of breakout sessions and it's a little pricey to attend. I don't know, it's like $300 or something. It's a lot. Those conferences are always, a bit, but
that coalition helps a lot with our legislative priorities, and we are a member of that coalition. It's like a trade organization, and they have a person who keeps us up to date on what's happening in Tallahassee.
And they have a website that you can access for good information and reports.
They have free trainings and stuff as well.
And be recorded, right? Don't they have recorded trainings that you can? And then there's new funding. Do you want to talk about that?
There's new funding we just heard about from the city of St. Pete, rapid unhoused survivor housing. That is a rush grant. So there's rush funding that came down from the federal government, and that is related to any area that's experienced natural disaster. And so that is for the city of St. Pete. Again, we do share those resources on the websites to make sure, because they're partners, of course, and funders. Part of the CFC.
Any questions? Any online questions? Any questions online, or anybody else have questions here? No? Well, I thank you all for attending. It's been a pleasure, and hope to see you at the next meeting or in a committee meeting. Or sit in the board of directors or whatever you'd like. You are always welcome at the CoC.
It is very interesting.
Okay, so now with time commitments.
This is-
Night,
Night, everyone.
Bye.
It's